everyone, Stefan Harbin here, Iron Direct Primary Care, bringing my lecture on chronic back pain treatment. I have a lot of experience in this subject. I worked in spine surgery, in neurospine surgery, and interventional pain management, and I learned quite a few things along the way. So what can be done? Unfortunately, there's a lot of defeatism among practitioners and in the literature regarding low back pain. While I worked for Dr. Duke at the Duke Spine Institute, one of my job was doing research on spine conditions and specifically surgical outcomes. And the literature oftentimes will say that back surgeries don't work. The issue with this is that it's surgeon dependent. I mean, that's not a surprise. If your surgeon isn't skilled, you're not going to have a great outcome. Dr. Duke is probably one of the best surgeons probably on the planet. He just happens to have an amazing center down the road here. And what I saw there was nothing short of miraculous. His surgeries are cutting edge, minimally invasive, and patients definitely get better. I'm going to go through all the modalities out there, surgical and non-surgical, holistic and alternative, to give you guys kind of a comprehensive overview of how to fix chronic back pain and how to diagnose it. So, facet syndrome, this is an RFA. So RFA is basically an ablation, a laser treatment of the nerve. It's a burning of the nerve. So you have the facet, we talked about that in the last injury, it's this articulating joint in the spine, and it gets arthritis in there. Degeneration, your spine starts compressing over time, you start getting this rubbing there. A nerve that exits through the facet gets pinched off, causes pain every time you move your neck, or just pain all the time. Conventional therapy is you go to an interventional pain specialist, like Dr. Patel at the Duke Spine Institute. Hey, and he was a magician with this needle. He would go right in, and he would do a first thing, it's called a block. It's a diagnostic block, where they would inject a little bit of steroid and lidocaine. If the pain went away, that told him that that was the nerve that he needed to treat. Then he would schedule the patient for a follow-up. They would go in and they'd burn the nerve. It's called a rhizotomy procedure. Typically, though, this procedure would be great. The patient would be out of pain for about 6 months. The nerve regenerates. Yes, nerves do heal. They come back, right? And maybe if you're on some anti-aging medicines, like what I do, it might come back faster, right? I have ways of making nerves grow faster and helping the body heal faster. So the pain may come back. However, if you do chiropractic care, physical therapy, which is always recommended and advised and prescribed at the Duke Spine Institute, the pain may resolve. If you add on a good diet, a lower inflammatory diet, you start building your muscle mass again, right? Maybe you optimize the hormones. There's a possibility that maybe the pain won't come back so severe next time. So that's an RFA. Rhizotomy procedure, it treats facet syndrome. SI joint injection. So SI joint, super common reason for pain, lower back pain, often misdiagnosed, difficult to diagnose. You need to know the anatomy, you need to know what you're pushing on to diagnose this. For a skilled clinician, I mean, I got pretty good at this when I worked for Dr. Duke. I could find SI joint pain, I could diagnose it pretty accurately and get the patient the right therapy. And the right therapy there was a steroid injection. So you would go with Dr. Patel under fluoroscopy, which is radiographic guidance, where you would inject dye into the area, and then you would see where the injury is, or you would see the SI joint, and you would inject the medicine where we knew the injury was or where the pain was. Patients, again, felt great after this. Sometimes they didn't. Sometimes they would need a couple treatments of these. And again, they would always prescribe chiropractic care and physical therapy. And this was a common theme there. This is why I like the Duke Spine Institute so much, is because they've used chiropractic care and physical therapy every time they did these injections. Because they realized the injection is just one part of it. You need a complementary and integrative approach to healing chronic pain, right? You need the patient to be on board. They need to fix their diet too. Piriformis syndrome. Piriformis syndrome is a super common condition. It's a tiny little muscle in the buttock area. And people typically have atrophied butts. They have weak butt muscles. And if you have a weak butt muscle, all your pain is going to go into this little area called the piriformis. And the piriformis, my God, this is not cooperating. The piriformis can't take your weight. Let's just put it simply. Easy to stretch this, easy to tear it, and it's a super reason to have a lot of pain. You have this sacroiliac joint. You have a sciatic nerve that goes beneath and underneath the inflamed piriformis. So if you have an inflamed piriformis, you're going to pinch off your sciatic nerve, and you're going to get sciatica shooting down the legs. So you may not have actually a bulging disc. You may have actually piriformis syndrome. And it was my job to differentiate these two, and I got pretty good at differentiating the two. Right? And treatment for this is, once again, you can do an injection there of a steroid into the area and relieve the pain. It's done under ultrasound guidance because it's a difficult nerve to hit. It's kind of deep in there, but with a skilled interventional pain management specialist, you can get it. And again, the treatment afterwards is physical therapy and chiropractic. So there's a couple piriformis stretches here. The physical therapist would always go through this with the patient and teach them these so that hopefully you could rehabilitate not only the piriformis but the muscles surrounding it, so you could then support your own butt muscle, the piriformis muscle. Greater trochanteric bursitis. Wow, this is a common one. People will say they got back pain, but oftentimes it's trochanteric bursitis because you get pain here, it'll radiate all over the place. It's just a fluid-filled sac on the outside of your hip, and it gets super inflamed and painful, and people live in a lot of suffering. Treatment for this is a steroid injection once again, and then physical therapy and chiropractic every time. I also believe that using other treatments, obviously here we'll use dietary changes. Maybe we'll use BPC 157. I love that medicine as a healing peptide. It also helps reduce inflammation. So those are two modalities that I currently use. So with all of these, platelet-rich plasma and stem cell therapies are an option as well. Now, we didn't use that so much at the Duke Spine Institute because it wasn't covered under insurance, and it's prohibitively expensive. I'm hoping to offer that to my patients at some point. I think PRP and stem cell are great regenerative medicines, low harm, and a lot of upside with them. But obviously the simplest and cheapest way is to just do a steroid injection. The problem with steroid injections is that over time, they'll just weaken your joints. They don't help it heal. They just cool off the inflammation. Some people, they get good results out of that, but sometimes the patients need to keep coming back, and that's what we often saw at the Duke Spine Institute. These patients kept coming back. We need to basically change the tires, rotate the tires, and give them another steroid injection, and then they'd be good, ready to go back, go and eat at Burger King and Dunkin' Donuts. You'll be back in 6 months. Keep it up. Herniated disc. Right, so herniated discs, we talked about that in the last episode, the signs and symptoms of herniated disc, but how to treat this thing. Well, typically this thing doesn't go away. Once you have the mechanical injury, that annular tear, it doesn't go back in. You can do physical therapy, you can do chiropractic. Maybe my colleagues in chiropractic can talk more about that. But as far as I know, from a spine and spine surgery standpoint, herniated discs don't repair themselves. And so we would try alternative modalities. We would try steroid injections. We would do chiropractic physical therapy, sure. But most often, patients would end up on the operating table for a procedure. Now, the traditional procedure is an open back surgery. You make a long incision, and you take out the joints, and then you put in basically artificial joints in the form of screws and rods. So I did some of these surgeries with Dr. Duke. Dr. Duke, he is the best at this, and I just saw the precise details that made him the best at this. It's little things, like asking the patient if they're on fish oil or turmeric, blood thinners, right? Why did he want to know if the patient was on blood thinner? And it was bleeding control in the operating room. So patients if you control their bleeding in the operating room, you'll have less blood that escapes. So one, you'll lose less blood, but two, you'll have less muscle damage. Dr. Duke was an expert at preserving the muscle and being super careful with it. Dr. Duke understood how important the muscle is to the human body. And you don't want to go in and butcher the muscle because the patient will have terrible pain and terrible recovery afterwards. You want to be very careful with the muscle. You want to make sure the patient doesn't bleed into their muscle because their recovery will be worse. However, Dr. Duke's flagship operation was the Duke laser disc repair. This is where he would go in with basically a pen-sized instrument, and he would go into the level of injury. So we'll bring back the level of injury here. He would go into here with the straw-shaped instrument, and he would laser off this disc herniation, relieving the impingement on the nerve and providing patient essentially immediate pain relief. It was quite miraculous. I would see the patients right after the Duke laser disc repair get up and tell me their pain was gone. I would see them the next day in the clinic for a follow-up, and they'd be walking around with no pain in their neck, in their arms, in their legs, wherever the disc herniation was, wherever we repaired it, that pain was gone. It was incredible. And the recovery time was essentially like then, right? There was no big scar. The incision was like literally this small. Dr. Duke's a wizard and will go in with it through a pen and fix people like that. Patients will then be in a brace, just like you would be in a brace after a big open back surgery. But the reason for the brace here is because you need that tear to heal. Now, while Dr. Duke removed the herniation, that tear is still there. My theory always was, can we use regenerative medicines to help heal it? Well, I'm thinking at BPC 157, maybe stem cells, PRP. He doesn't do those. I would think also like collagen peptides, really focusing on getting the nutrients into the diet to speed that healing. But typically the healing process was about 6 months. So patients would be in a brace, they do their physical therapy, and they do the chiropractic, all safely done, all monitored in their clinic. And patients had really great outcomes with this. You know, unless they like picked up something super heavy and they re-herniated, the patients had no pain afterwards. So what are the alternatives to conventional treatments for this? And I wouldn't even call Dr. Duke's modality conventional. It's almost, I would say, an alternative surgical modality to the traditional fusion, right? So you have to, one, understand that it's a chemical inflammation. So we can control a chemical inflammation. Sure, steroids. But other modalities, right? Diet, supplements, peptides, hormone optimization. You control that inflammation, the pain might get better. If you have myelopathy, if you have actual weakness, though, that's a different story. You need to go to Dr. Duke. He probably needs to do an operation sooner rather than later, right? The nerve dies with time. Anti-inflammatory diet. Supplements like turmeric curcumin, yeah, they might help with inflammation. I don't like them long-term because of oxalate formation, kidney stones. They're less powerful. Most people, if you have a bad pain, it's not going to help. And then people are stuck on ibuprofens and Tylenols and opiates, and my God, you don't want to get down that road. Low-dose naltrexone, I really like this medicine. Has low side effect profile. It's anti-inflammatory, modulates pain signals. I have a very low threshold for prescribing this one because it helps for so many different purposes and has low side effect profile. BPC 157, I love this peptide for healing purposes. I've used it on my own nerve injury in my neck multiple times. My experience with this one is I sometimes have to cycle this back on. So it will treat the pain, it'll treat the inflammation, and if I'm really good about diet and chiropractic, the pain doesn't come back. But if I slack off on those, I'll get the nerve pain again, and then I have to cycle back on BPC 157. Not a huge deal, it's a bit expensive, that's the only downside. Growth hormones and other peptides can also heal with healing. So we want to optimize growth hormones. We want to optimize, testosterone for men, progesterone, estrogen for women. This will help with inflammation and healing as well. Stem cell therapy, it's amazing anecdotal results I've seen from patients of mine in the literature, case reports. It's expensive though, it's sometimes prohibitively expensive. Hoping that one day I might be able to offer this to my patients, but right now it's prohibitively expensive. A good chiropractor and physical therapy, as always, should be a part of any chronic discogenic pain, or not always discogenic, so arthritis, facet syndrome, greater trochanteric bursitis, piriformis, right, muscular pain. You want to have a good chiropractor and physical therapist in your corner, and that can really make a difference. I don't recommend long-term systemic corticosteroids, NSAIDs, Tylenol. They're catabolic. They decrease your ability to heal. They damage your tissues and organs. They're counterproductive, right? You prefer to go to a skilled interventional pain management who can guide a needle into the precise area of inflammation and deliver a corticosteroid. I mean, that's the only real way you want to use corticosteroids. And the last option would be spine surgery or nerve ablations. However, you want to see someone who's the best. You don't want any butcher going in there. I recommend the Duke Spine Institute. That's the only type of person or institute I would want operating on my neck or my back is the Duke Spine Institute. I've seen what they've done, and it's top quality. Hope you guys enjoyed this lecture on spine, discogenic pain, radiculopathy, modalities to treat it, and hope you guys found this educational. Talk to you all next time.